Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. A client who is positive for human immunodeficiency virus (HIV) is to be discharged and will be taking zidovudine (AZT) at home. Which of the following actions by the nurse is best? 1. Review the importance of adhering to a 4-hour schedule. 2. Advise the client to buy a timed pill dispenser. 3. Write the schedule of when the medicine should be taken. 4. Encourage self-medication prior to discharge. The correct answer is 3. Planned and written schedule of administration is more effective for adherence to time frames. The nurse recognizes which of the following as a positive response to fluoxetine HC Prozac. 1. The nurse notes hand tremors and leg twitching. 2. The client states that he is able to sleep for longer periods of time. 3. The client has an increased energy level and participates in unit activities. 4. The nurse observes that the client is hypervigilant and scans the environment. The correct answer is 3. Fluoxetine HC Prozac is an energizing antidepressant. As client begins to demonstrate a positive response, he has an increased energy level, is able to participate more in milieu. The nurse is supervising the staff caring for 4 clients receiving blood transfusions. Which of the 4 clients should the nurse see first? 1. A client complaining of a headache. 2. A client vomiting. 3. A client complaining of itching. 4. A client with neck vein distension. The correct answer is 2. Hemolytic reaction, most dangerous type of transfusion reaction. Symptoms include nausea, vomiting, pain in lower back. Hematuria. Treatment is to stop blood, obtain urine specimen, maintain blood volume and renal perfusion. The nurse is planning care for a client on bedrest. To promote evening rest and sleep for this client, it is most important for the nurse to 1. Provide privacy. 2. Give back rubs at HS. 3. Assist with a bath every day. 4. Encourage daytime activities. The correct answer is 4. Provides relief from tension, ensures client naps less during the day, helps client to relax. Which nursing interventions would be a priority in preventing complications after a cesarean birth? 1. Turn, cough, and deep breathe. 2. Limit fluid intake. 3. Supply a high carbohydrate diet. 4. Evaluate skin integrity. The correct answer is 1. Represents preventive care for respiratory congestion resulting from anesthesia and shallow respirations due to the abdominal incision. The nurse is caring for a client who has just returned to the post-surgical unit following abdominal surgery for cancer of the colon. It is most appropriate for the nurse to take which of the following actions? 1. Determine the stage of loss and grief. 2. Analyze the quality and quantity of pain. 3. Instruct the client to cough and deep breathe. 4. Ask the client to lift his head off the pillow. The correct answer is 4. Should assess whether there are any remaining effects of neuromuscular blocking agents, may block ability to breathe deeply. A nurse recognizes that an initial positive outcome of treatment for a victim of sexual abuse by one parent would be that the client 1. Acknowledges willing participation in an incestuous relationship. 2. Reestablishes a trusting relationship with her other parent. 3. Verbalizes that he is not responsible for the sexual abuse. 4. Describes feelings of anxiety when speaking about sexual abuse. The correct answer is 3. Victim needs assistance to challenge belief of victims, which includes I am bad and deserve the abuse. A 38-year-old woman is returned to her room after a subtotal thyroidectomy for treatment of hyperthyroidism. Which of the following, if found by the nurse at the patient's bedside, is non-essential? 1. Potassium chloride for IV administration. 2. Calcium gluconate for IV administration. 3. Tracheostomy setup. 4. Suction equipment. The correct answer is 1. Hypokalemia is not expected after this surgery. The nurse knows that the client with drug-induced Cushing syndrome should first be instructed about 1. Compression fractures from increased calcium excretion. 2. Decreased resistance to stress. 3. The schedule for gradual withdrawal of the drug. 4. Changes in secondary sex characteristics. The correct answer is 3. If steroids are withdrawn suddenly, the client may die of acute adrenal insufficiency. Which of the following is a correct instruction by the nurse to the parent of a 4-year-old client regarding collecting a specimen to be tested for pinworms? 1. Collect the specimen 30 minutes after the child falls asleep at night. 2. Save a portion of the child's first stool of the day and take it to the physician's office immediately. 3. Collect the specimen in the early morning with a piece of Scotch tape touched to the child's anus. 4. Feed the child a high-fat meal, and then save the first stool following the meal. The correct answer is 3. Pinworms crawl outside the anus early in the morning to lay their eggs. If you want to practice more test-taking strategies for your NCLEX exam, then click on the link below in the description. You'll land on a page where you can enter your details to get instant access to a free online test bank. Consistently practicing test-taking techniques is one of the best ways to pass the NCLEX on your first try. It's time to become a registered nurse. Click on the link below. Now.